Hello there. Welcome to the Healthcare Executive Insights podcast. My name is Elliot Sloan with the Macallan Group. Today, we'd like to welcome our guest, Mr. Larry Epstein, who is the CEO of the Pediatric Urology Associates Medical Practice. Larry, thank you so much for taking time to chat with us today.
Well, it's always a pleasure to speak with people who are looking to give insight and gain knowledge across the digital spectrum.
Absolutely, Larry. The pleasure is all ours. And tell us a little bit about your professional background, and then we'll talk about the practice you're currently operating.
Okay, so I've been what they call euphemistically from my professional association, a medical practice executive. I've been doing medical practice for over 30 years. My current role is with a pediatric subspecialty group in the tri-state New York area, which focuses in on urologic care for ages 0 to 21. We have 15 offices around the tri-state area, Connecticut, New York, and New Jersey, but our main focus is probably in Metro New York area in the marketplace.
Got it. And how's the competition for pediatric urology in the tri-state area?
Well, it's very unique in the fact that this is a highly competitive market. As I mentioned a little earlier, when we were doing our prelims, we are in a space that is probably controlled by children's hospitals or academic medical centers throughout the country, and they're able to capitalize or bring on the specialists to maintain them to services for a community. New York's unique, and we're kind of, I would say, a dinosaur in that we're affiliated with a lot of teaching facilities, but we're still independent. So we have relationships, we have contracts, but we aren't really integrated partners with any one particular health system or capital partner in the market. So that is in itself saying that we're in a highly competitive marketplace. 15% of all pediatric urologists seem to be wanting to work in the tri-state New York area throughout the
Really?
entire country.
Wow.
Yeah, there's only about 800 practicing pediatric urologists in the United States. There's 62 in the tri-state New York metro market.
Wow. What causes the draw to the Northeast?
I think some of it, as I mentioned, has to do with the training programs
Sure.
and the relationship of the large amount of training programs and large hospital systems in the tri-state area.
Yeah.
And they've been growing like crazy. And that's a market that I would say that goes up to from Hartford, Connecticut down to Philadelphia. It's
Sure.
not just Metro New York.
Got
So
it.
there's about 16 training programs in that space, training pediatric urologists or pediatric specialists. So usually the case is people choose where they train, where they want to live,
Sure.
usually. So they end up staying here and starting to work. There's always a need for the specialty because there aren't that many and they're hard to get access to.
Yeah.
So with all that said, the competition is still fierce, and that's some of the things that we're struggling with right now because of it, because of our being competition is having the academic medical centers of the health system such as Northwell or NYU or Columbia Presbyterian to invest and bring on people from out of the area or roll them up in to compete with us.
Sure. Yeah. And tell me, how have you been able to put up a fight against these larger academia health systems to capture new patients and new families that have children who need urology services?
We do a lot of things that make it valuable to the pediatricians and their families to send to us. One is access. We are open 5.5 days in a week, 10 hours a day. That's all we do is see pediatric urology. We don't compete with anything that the pediatricians want to do. So we
Sure.
provide that access. We provide services in at least 14 operatories or operating rooms around the tri-state area. So there's easier access to if the child needs intervention of any sort. We perform some services that not anybody would perform in a medical group, which has to do with childhood bedwetting or bladder control through ancillary service providers. And we're really a full service enterprise. We have people who are very well trained. We do robotics. We do high-end surgery. We actually training faculty for a couple of the hospitals through
Oh, wow.
affiliation and contract. So all those together help maintain it. And we also do a lot of marketing. We've emphasized doing digital marketing, digital branding. We reinvented our website the last 2 years. We brought on a team to help us with digital social media and ad buying, and really building our brand through Google reviews as well.
Yep. Absolutely. So you have been aggressive with going direct to consumer and knowing what content to put out at the right time on the right platform to really cater to these families that need your specialists.
I could say that, and it's always, as you know, by the field you're focused in, it's always a work in progress. You always have to fine tune it and do well. I just had a meeting a day or two ago with that group, and we had a conversation about what should we disband and what should we rebuild, and what's been successful to try to hone in that messaging a little better, or find ways to do a better job,
Yep.
and try to see maybe where we might be falling short in terms of growth and opportunity for that. Is there services that have been identified by outside parties that we should be bringing on site for us?
Sure. Are there any technologies that you're using that you would speak highly about that have helped you improve any processes, intake processes, marketing automations, or even patient care?
Well, the pandemic put us on a journey to have low touch, high tech intake, registration, insurance verification, claims processing.
Yep.
So we went on a journey in relationship to try to find a partner to help broaden our ability to allow people to use smartphone technology to do their intakes and do it before they came in, on a time where they felt comfortable and not highly compressed in the office time.
Sure.
So about a year ago, we brought on a partner. Um, if you don't mind, I'll mention them. They're Phreesia. They're a company out of New York. They have been in the space for a while doing digital intake and registration. They have a synergistic integration with our electronic medical record and billing systems.
And
So
which
that
EHR do you use?
we use a company called eClinicalWorks
Of
out of
course, they're a big
Boston.
one.
So we've been working with them for a long time. So we worked on that integration and have been using the product for about a year with highly success, because I haven't really had to add back post pandemic, even though our market has grown back up again from pandemic period back to the front desk or the registration or our phone use. We've kept our FTE levels similar because we've honestly pushed down some of that arduous work of intake and management to the
Data
patient,
entry.
which is honestly someone on their plate anyway, to make sure it's done right the first time and not rushed, so there aren't any errors in the
Sure.
process of information that they want to pass along, like who should be their guardianship, if there's guardianship relationships,
Sure.
or how they want to be contacted, and do they want to be contacted, as well as just the general paperwork they need to process day to day.
Sure. Yeah, that makes a lot of sense. Anything that you can invest in to streamline the processes. You hear the term digital health a lot. Um, what do you see as the future as far as bringing healthcare into the home, not just in the doctor's office?
Well, depending on what services you provide and what diseases you treat, it's very varied. It's variable, let's just say.
Sure.
Um, a cardiologist or an endocrinologist who manages the heart through a lot of different metrics that have been able to be put on an Apple Watch or a smartphone, or you can do blood pressures and heart rates, and those things can be done remotely in the home, as well as there's services that you can take away from the hospital or the office and bring them to the home, like infusion services, et cetera,
Yep.
or injections, or what we found. Look what we found with COVID. We were doing PCR
Testing.
testing in the home,
Yep.
and being able to deliver that. So that's going to be a changing space. It puts more pressure on the medical practice, though, to be able to garner and keep track and find pathways to the information pathways to manage all that information coming forward, or data coming forward. So it's a challenge. But I think as the technology space keeps broadening, especially from an artificial intelligence standpoint, it allows for more and more of this information to be garnered and be evaluated. Because the goal ultimately is to keep someone healthy,
Yep.
child, adult. So if your goal is to, as a doctor, is to make sure you see them regularly, but also not see them too regularly, you want to be able to provide them resources or tools. Prior practice before this one was on sleep practice was part of our pulmonary practice, was very large. We were just starting to dabble in being able to get information of people's sleep patterns and use of technology to help them sleep better through positive airway pressure and other devices that were being there, and monitor their heart rates and their pulse oximetries and stuff.
Yeah, what a
Which,
game changer that must have been for you.
yeah, it was definitely a game changer because it allowed them not to have to be unburdened by making a visit to the office. They could be managed home. And if there was found there was something that couldn't be managed from the home, they would be able to be quickly brought in and see not a doctor, but a technologist or a therapist at first to see whether or not that could be intervention could be made quickly and titrated the device or make the information a little bit better so that person could sleep better and manage better their lives.
Yeah, that's a great example of really bringing healthcare to the home with sleep apnea, which a lot of people suffer for, and what an inconvenience it is to have to go into a facility to get sleep tests done.
Right. So that's between the testing and the actual treatment with
Yeah,
PAP and other things, the technologies move forward very quickly to be able to manage it from home.
sure. So, Larry, tell me more about culture in a medical group and how important you feel the culture is at a medical practice to be successful in delivering high end patient care.
Well, ultimately, how you approach the patient or the family is probably the key to success of any practice. If you don't take them and put them in the center and make that the culture, as well as your employees, they're the center. Uh, and that includes the physicians or providers as well. That it moves from the center outward to help them manage the patient or manage the care. That culture that you create that says who comes first and who comes last in terms of need and resources, et cetera, you're not going to be successful. Um, Luckily, there are now tools to do a lot better job to measure that could do on the internet than when I first came in, which was a lot of paper surveying or individual interviewing to see how well you were doing. So I think that in of itself and that a rapid turnover of the information allows you to keep that sense of centeredness and patient first practice out forward. And that's always been my case. I've not been one to ever wanted to really burden the practice with my personal vision of what I thought healthcare should be or what practice should be. It's really I bring in what the values and the culture and the resources that my ownership team wants to bring together and manage. So that in of itself is probably my biggest. Culture's been big, but I've also been a big believer in personal visibility. So always was known as a floor walker when I first started, even in a large facility. And sometimes I get in trouble for floor walking because when you floor walk, you find issues or problems that need to be bubbled up and answered. So my mantra everywhere I've gone has really been to visit, interact, get to know our clients, the patients, the families, but mostly our staff to make sure they understand what's priority and what they need to do to bring to that so they can have a good day because they spend 8.5, 9 hours a day there. And
Yep,
and then tell them we don't want them to bring what they do at those 8.5, 9 hours home unless they choose to. You
sure.
know, so I think that helps and them being flexible. We were very the pandemic probably ripped open not just bandages, but just wounds of different things that needed to be addressed. But being that we were always centered first, those things were already at the forefront. So when we had to make decisions adroitly to save the practice and not have it have to be rearranged totally. We ultimately had to be honest and frank with our staff about having to short-term lay them off, but with the idea, with the hope that things would improve quickly, and they did over time. And that measurement and trust brought them back
Yep.
and allowed us to reopen quickly and to do things in a better way, as well as open and honestly tell them how things were doing and what was happening with our practice. I try to do that and communicate that from top down through our management of our sites onto the desk. But I always have an open door policy, so to speak. Anybody can email me. Today, I had providers say, "I need XYZ. Can you help me get it? I don't have time to do this, today." So, of course, I'll
Sure.
see what I can to do because I understand how to do it quickly. You don't have to struggle through asking questions about
Sure.
what's needed. So that's kind of where I believe culture is. It's usually who you're servicing and you do it well, and you always look to improve. Those are probably the two big things I would go out in terms of culture that I've had over my many years of
Yeah. And you've been
management.
involved in a lot of different practices, different specialties, uh, groups in high growth mode. So it sounds like you've really been around a lot of different environments as far as good cultures and maybe not so great cultures.
Yeah. Well, I learned about bad culture early on when I was in higher education and in the management side. I saw early on that that group of people didn't really take into consideration what the students' needs were. It was
Sure.
about what their needs were. So, and I just didn't want to work for organizations like that. So,
Yep. And you flipped it
um,
upside down and said, no, we start with the client or the customer or the patient first, and then
right.
we work
Yeah.
backwards.
Yeah. So usually there's been an axiom: right place, right time, right dollar. And I've kind of taken that as a mantra as well. Always make sure it's the right place, right time, right fair market value of the service, and you'll get a return for those people. Bring back your family members and you refer you to other people to take care of the future family.
Talk to me about managing a practice with a lot of different providers and maybe a lot of egos. I'll use the word. Um, being a CEO for a practice that is complex with uh, the roster between providers and staff. How do you manage the cohesiveness and the balance between the staff and maybe the providers getting everything their needs and desires addressed, and also the front line, which is the intake, the receptionists, the nurses, the MAs, PAs. It seems like sometimes in practices it can be challenging to keep everyone's considerations equally valued.
Well, that's a communication and making sure everybody's on a communication status that they can communicate well without fear of retribution or reprisal or that they're going to be hurt by communicating if they found an issue or a problem.
Yeah.
And I honestly have been, and I was attacked at my early on in my career for being egoless. So I approached the people who own the company, or when I worked in academic medicine, as scientists, and scientists like data. So I approach things with a data-driven approach,
Yep.
and give them information that they want and they want to see. They can debate it. They can say, no, I don't believe in it. But I say, if the trend is this way, showing the trend, that's the trend.
Yeah.
How do we change it? So that's
It's
always
not an
been my
opinion.
route. It's not an opinion. It's not my idea. It's how I do it. And so that in and of itself, they appreciate it because they're medical scientists. And there's two things I've always found that I learned early on. They want to go home. They want to have a life outside of medicine. They don't want to be wedded to medical profession. They have other interests. So during the time that they're there, we try to make it, and the staff knows the goal is that they can work as a team to make everybody get through their day a lot better, a lot faster, a lot easier, and make sure they're well respected for whatever they're doing, as well as make sure they respect the client. And when we get negative feedback, make sure there's a feedback loop that shows it and what happened, and then take what their account of the situations were and try to relay it forward.
Sure.
There's sometimes the customer isn't always right.
Yeah.
They came late. They got they didn't realize there were three other providers in the group in the office that day. So why were other patients being taken ahead of them?
Yep.
So it's really just a lot of factors going into play. So it's mostly communication, giving them information that they can react to, and making sure that there's constant feedback when they do that.
Sure. Transparency and ensuring everyone's voice is equally respected and heard.
hmm Pretty much, I've always kind of worked, but mostly, sometimes I have to put a veil over things. Not everything has to be transparent, but I think that's got to do with the nature of the business. And I'm always one that says to my group, because I've never been an owner as CEO. I've only been a non-senior owner, senior executive.
Sure.
Want me to make decisions as an owner, I'm going to make them as a business person and not as a physician. So you better decide quickly how you want, which decision path you want me in, which decision path you don't want me in. Because I'd be happy to do it at any point, but you may not like the way I approach you having to manage your schedule day to day,
Sure.
and or coming on time or whatever case
Sure.
may be. You
Sure.
know,
So my question is recruiting top talent, top providers in their own specialties, especially in a time where staffing in the healthcare industry has been a struggle. You've been a part of a lot of groups that have been scaling and growing quickly. What has been some of the strategies you've used to recruit the best talent to your medical practice?
I think it's been again a communication and team approach to identifying the need first off, because if the need, they may think the need is there for top talent, or that there's too many things happening that they need to recruit talent. It may not be true. So make sure that that assumption is correct and why they're doing it, and put it and articulate down those assumptions. Once you articulate those assumptions, you could then market those assumptions to people who might be interested in where you are. Luckily, I've been in an area of the country that's highly desirable, um, but understanding it's also highly competitive. So knowing that set of facts, you go approach your pool candidates who might be interested in coming to work for them. Even in this practice, we went through a turnover time where someone left to go back to more slower academic pace, and we had a vacancy. It took us a while to identify what the real need was, where that need was going to be met,
Sure.
and then trying to find that person who wanted to be here and for whatever reasons they could be. Um, and that includes family life and where they were in their careers, et cetera.
Sure.
So we had a bifurcated approach. We went after some senior people who were in the market already who wanted to work with us, and then we went after people who were just coming out of school who wanted to be able to cut their teeth and work hard, but also have the idea that they would learn it. People have been doing it for a while and like teaching. So
Sure.
it's really more of a marketing strategy or an effort to bring in and identify who they are. Now, honestly, there are only 35 to 40 people coming out a year of fellowship in
Wow.
pediatric urology. So it's highly competitive, and there were twice as many people looking for people to hire right now than when we were hired. But luckily, we found someone who was not happy in their current environment, was local, and wanted to come work with us. So
Sure.
we identified the need about where they could work, and it slotted in well for them.
Perfect.
So that's basically how we've done it. If you're in a relationship with a medical center or a health system, you go to them and see what their needs forecasts are and what they want to do, and what we can do together to help market, and it may be marketable to some people to say, look, you're not going to be owned by the health system, but you'll be clinically affiliated and contracted with them. So you'll have some flexibility in how your lifestyle is. You won't have the senior health hospital executive looking over your shoulder.
Sure.
Um, so there's a lot of factors that go into that recruitment.
Yeah. And I know you've been a part of some other practices that had gone through private equity rounds or mergers and acquisitions with health systems. Share with me what your experience have has been over the years. What have you learned when a practice is looking at their next chapter and looking at joining a health system or partnering with private equity? What's your advice, and what are some things that a practice owner should be thinking about going into these meetings or opportunities? What can you share with our audience of uh, best practices or things to avoid?
Well, first best practice is to get, if you don't have someone like me who can help give you counsel and advice internally first, go out and find your best counsel and advice. And that's not from a legal standpoint. That could be someone who's done a lot of these mergers and acquisitions in the past, and or even knows the market very well, but and can help guide you and meet your practice needs and your expectations for the not just the 1 year, but the 10-year and 20-year plan for you as a provider or a group of providers. Second is, again, figure out exactly where you want to be and how you want to approach. And are the partners you're approaching understanding about what your needs are and what their needs are and how much they can match up as best they can to that. Um, every specialty is a little different.
Sure.
I'm dealing with different dynamics now for this practice and trying to find business partnerships than I did with the last two groups I merged before. The first group I did a merger, oh, almost 20 years now. They were going through financial difficulty and couldn't re-recruit some of the mix of specialties as a multi-specialty practice.
Got it.
So we had to approach who could best service that need and service the community and not have to disrupt the in practice entirely and shore up the financial base.
Sure.
And to this day, they're still together. So I guess that was pretty well a good choice. Again, the last practice I did before I'd done this, they again, they're on their second turn of a long-term deal, which is what I would focus in on and say to them, hey, why did you do that? And it was partially, again, they saw the market turning. They needed to have a partner. They looked at different alternatives and they decided the best bet was to move into the health system mode versus trying to pull together a private equity deal, which they originally thought they would want to do. And we had done a lot of due diligence. And honestly, that market in New Jersey would have been totally changed if the groups that had gotten together in
Sure.
terms of that one specific surgery line. It would have been a different marketplace totally.
It would have been a
So
super group that would have taken the whole market, basically.
for market, pretty much, I give examples in New Jersey. There's an independent group, but they've taken the structure where they affiliate with a lot of health systems. They're called ID Care. Uh, Dr. Nahas, who's a senior there, um, really kind of had a vision for what he thought infection care, infection control, and infectious disease management could be. And then took that and took it and broadened it and merged a bunch of practices together. And so they control a certain marketplace and they provide a certain amount of services. And then they broaden their services to other areas that you wouldn't think normally of an infection control, like travel medicine
Sure.
or other areas.
Sure. And is there an answer to um, who seems to be a better fit for a health system versus who seems to be a better fit for a private equity partner?
Um, no, I think every deal is unique and works out individually.
Sure.
I think they both have their values and both have their ideas and what they need. Some of them work out well, and a lot of things work out poorly in both sides. There's not one or
Sure.
the other that makes most sense. As I said, you got to figure out what
Sure.
makes more sense for you. If you're looking to get value out of the thing you put a lot of heart and soul in, and you want to capitalize that some way, you're not going to get it as easily, possibly, with the health system as you would private equity. But
Sure.
private equity then puts on certain pressures with that investment that you wouldn't want to live with, maybe that you don't have to live with a health system, which says just live your life, be productive,
Yeah.
and keep on seeing patients and
Yep.
not cause too many problems, and you'll do well.
Yeah. So the the providers and the practice owners who maybe have a vision of their brand becoming a platform might be better aligned with private equity. And if they want to really grind for another 15 years to build out that platform, maybe even longer, versus joining a health system could be more aligned with maybe someone who's already been practicing for 25 years and looking to get more resources to maintain.
Right. No, that's part of it. I think, again, it depends. You can look at um, HSS in New York.
Yep.
They've had a platform of working with both private and public, and they've been their own little private equity network, so to speak,
Sure.
in developing regional base and even national focus.
Sure.
And there's been some people that originally came from the provider world and have gotten private equity and have done quite well, and others that have spun off to it and not done well at private
Sure.
equity.
Sure. Yeah, it's a very challenging roadmap to figure out what makes the most sense. But luckily, there's experts like you who have done a lot of these deals that practices can lean on for guidance.
Yeah. Well, that'd be again my major takeaway. Get somebody who can be your solid confidants and do it well. All the deals that are together are still together with the health systems or private equity that I've been involved with did that. They had good people representing them. They got good legal support. They got good financial support. They knew they weren't being taken advantage of, or they weren't taking advantage of the people they were going with. So it was an equal mix of wins and losses, and they figured out what would be best for them. And they still had the culture and the resources and information that keeps them going.
Absolutely. Well, Larry, I want to thank you for your time today. I know our audience will really enjoy tuning into this conversation. And we'd love to catch up with you sometime next year to hear what's happening with the Pediatric Urology Associates as far as your growth and your wins on the board.
Sounds great. I'd be appreciative of that. I'm always, as I make these synergistic relationships are together, now you're part of my network, and
Surely.
I'm here to help. I'm here to reach out to your uh, network of podcast listeners and help out any way I can.
That's terrific. Yeah. And when we publish this episode, we'll make sure we include your contact information so folks who have additional questions for you can certainly follow up.
Sounds great. It's been a pleasure, Elliot. Be well.
Thanks a lot, Larry. We will be in touch and best of luck.